Hi, my name is Allison, and I am going to be doing the insulin drawing video, and I'm a student for Nightingale College. So I'm going to check the AHR with the provider's orders. I'm going to compare that with the 6 rights of medication, which is my correct patient, correct drug, correct dose, correct time, correct route, and the correct documentation. So when I'm looking at the orders, the doctor has ordered 4 units of the regular insulin and then 8 units of the NPH or intermediate insulin to be given before breakfast. So I have all of my supplies with me, and then I'm going to knock on my patient's door, wait for them to welcome me in, close the door and our curtain behind me for my patient's privacy, and then go ahead and introduce myself. Hi, my name is Allie. I'm going to be your nurse today. What is your name and date of birth? Okay, I'm just going to verify that on your wristband. Okay, and that checks out. So today I am just going to be giving you some insulin per the doctor's orders. The insulin is for your diabetic management. It helps your glucose. It helps the glucose enter cells for energy. Some side effects that you could feel with the insulin injection is dizziness and nausea, along with, as any other injection, a little bit of burning at the injection site or tingling, but that is completely normal. Some adverse effects that you could experience is hypoglycemia, which is a low blood sugar, or hives, which could indicate an allergic reaction. Do you have any allergies that I need to know about? Any allergies to medication, food, or any other substances? No? Okay. Do you have any other questions for me before we start? No? Okay. So we did check your blood sugar this morning. It is at 160, so it is at in a range where we do need to give you some insulin. Breakfast is in about 30 minutes, so we're going to go ahead and give that to you now. Okay? Okay, so I have my medications. I'm going to have a nurse come in and verify my medications once again with me to the doctor's orders. So, hi nurse, my name is Allie. So we have the regular insulin here, and per the EHR and the MAR, the doctor has ordered 4 units of this regular one. And then here's the NPH, the intermediate. The doctor has ordered 8 units of this one. Okay, so I verified with another nurse. Thank you, nurse. I'm going to perform hand hygiene. Put on some gloves. And I'm going to take both of the vials and kind of roll them in my hands to warm them up and mix them up a little bit. And then I'm going to take an alcohol swab and clean both of my vials. And as those are drying, I'm going to get my syringe ready. This is a 1 ml 25 gauge 5/8 inch needle. I'm going to take this out of the packaging. Okay, so my vials have dried. I'm going to draw up 8 units of air. And I'm going to inject that into my NPH intermediate insulin first. So I'm going to double check. This is my regular NPH. Check it with the MAR. I do need the 8 units in that. Okay, so I'm going to inject the 8 units of air into that one. I'm going to take out my needle, and I'm going to draw up 4 units. 2, 3, 4 units of air and insert it into my regular vial. I'm going to actually draw that one up right away. I'm going to make sure I get out any air bubbles. And make sure I'm only getting out the 4 units. So in total, I will have 12 units of insulin with the 4 units of regular and the 8 units of the NPH intermediate insulin. So here is my first 4. And so I am gonna need, like I said, the 12 units. So I did not, all right, don't need to draw up the air again because I already inserted the air into my NPH. So I am just gonna insert my needle and draw that up. To the 12, making sure I'm not inserting any of the insulin back in, because then I would be inserting the other insulin into this. So I'm carefully drawing this up, making sure I'm getting it right to the 12 mark. I'm gonna check it again with the MAR, make sure I have the 12 units, cap this up. If I'm not giving it at bedside, make sure it has the patient's name and the orders for both the NPH intermediate insulin and the regular insulin. But just to show, there's my 12 units of the insulin. Once they are ready to administer, you'd administer it. I would toss the syringe following the administration into a sharps container, throw away my trash, take off my gloves, perform hand hygiene. Okay, Mr. Smith, we have given you your insulin. Breakfast should be ready shortly. Do you have any other questions for me? All right, you feeling okay? Perfect. Then I'm gonna leave my patient's room or document bedside just everything that I did with the 6 rights in mind: correct patient, drug, dose, time, route, and documentation. Thank you.